Occupational English test. Listening test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a pulmonologist talking to a patient, Mr. Richard. You have 30 seconds to go through the notes.
Hello, Mr. Richard. Now, you've been referred to me because it's possible that you're suffering from COPD or related condition. Can you tell me about the problems you have with your breathing?
I'm breathless most of the time, but the infection made it much worse. I was really frightened and felt that I was fighting for breath until the treatment started to work. Before the infection, I was breathless only when I tried to walk about. I can't get upstairs in one go. I need to rest on the landing and get my breath back. When I walk on level field, I can get as far as the back garden, but I'm fair jiggered after.
Okay, and do you wheeze?
Yes, I do wheeze and my chest often feels tight, but Dr. Mark is going to put me on something new, so hopefully that will do the trick, fingers crossed.
Hope so. What medicines were you taking at home before you came in today?
The blue inhaler, salbutamol it is I think, and the antibiotics from the GP for the infection. I am using oxygen at home for up to 15 hours a day. It's okay, we have a machine that takes some gases out of the air and leaves the oxygen for me. Think it's called oxygen concentrator, so the missus doesn't need to keep changing cylinders and I can get around in the house and out as far as the back garden. There are a few other things which helps, like sitting up and leaning on the table helps, but when I'm very chesty due to nasty cough it's better to sleep downstairs in an armchair. At least the wife gets some sleep even if I don't. A while ago I started doing relaxation exercises and that helps when I feel panicky, but they didn't work last night, worse luck.
Do you smoke?
No, not for years. I used to smoke roll-up cigarettes which I used to make myself, and I cut myself down to 10 a day, and then I said that's it. No more, and I haven't smoked for 5 years. It was hard, but I was determined to stick to no smoking. I had a smoker's cough when I was in the army, but now I cough any time of the day or night and bring up phlegm. It looks really green and the mouth tastes foul. They did send sample of sputum for lab for testing, and a physio helped me to cough and clear my chest for time being. And I do not have pain with the cough. Good news, I think.
Yeah. What about your daily activities and appetite?
I just need some help to wash my back and feet. My wife does it at home. With my eating and drinking, I'm trying to have a drink every hour like my doctor said, but I can't face a big meal. If I can meet a dietitian that might help though, I think. I really do not know what exactly to eat and what not to.
What about your sleep?
I've been struggling to sleep proper, like, you know. I get this awful cough, can't seem to shift it, and it wakes me up all hours of the night. It's like I'm hacking up my lungs, honestly. And on top of that, I've been getting short of breath, like even just lying down sometimes feels like someone's put a ton of bricks on my chest. I try to prop myself up with pillows, but it doesn't seem to help much.
Okay, after going through your symptoms I think you may be having emphysema. We are going to do few more tests to make sure we have right diagnosis.
What about treatment plan?
First off, the main goal is to improve your breathing, ease your symptoms, and keep things from getting worse. We'll start with some inhalers, bronchodilators. These will help open up your airways, make it a bit easier to catch your breath. Depending on how you're getting on, we might add corticosteroids to reduce inflammation in your lungs. You'll benefit from some pulmonary rehabilitation as well. It's essentially a program with exercises and breathing techniques tailored to you. It'll help boost your endurance and make day-to-day activities less of a struggle.
End of extract 1. Extract 2. Questions 13 to 24. You hear an audiologist talking to Mrs. Smith. You now have 30 seconds to go through the notes.
Good morning. I understand that you have come to see me about your hearing.
My hearing is no good. I can't hear them on the telly or the boss at the shop. I watch EastEnders and Coronation Street. They are the best and I like the football as well. I can hear you now all right, though. Because I can see you and nobody else is talking. And I'm calm. At times I get this ringing sensation. This is going on for about 6 months now. I did go to my GP. He checked my ears inside with a device, I think otoscope, and gave me drops for few days. It didn't help much though.
Okay, what do you do for living?
I work as a teller in the supermarket. It's a full-time job.
Anything I should be aware of?
I did get an ear wash with a syringe in my GP's office, and he removed wax. I felt better for few days after that. Now, I might need another one, I think so. Sometimes my ears feel stuffed up and I get giddy and stagger. I will never fall because I know it's coming, so I sit down. 2 years back I had infection in both the ears. GP said it was otitis, there was a lot of discharge and pain, and he gave me ciprofloxacin drops and it cleared in a week.
How are you managing your work now?
Well, I have given a hearing aid. I use it few times. I really don't like it though. Now it's broken. I did take that to a technician. He couldn't fix it anyways. Even if it works now, I don't want to use it because it wasn't good enough in the first place. If I can get a new modern improved one, it is better.
Do you have any chronic health problems?
Yeah, I am diabetic and taking Novorapid Penfill for the past 3 years. I was first using oral tablet for 5 years before starting insulin. Otherwise, I am doing okay. I forgot to mention, I take statin to manage my cholesterol, that's it.
Anything important among your family members like past diseases?
Yeah, my father had early onset dementia. I don't know whether it has anything to do with me. My sister is suffering from depression and anxiety. She lives with me currently. My mother had issues with balance. She felt giddy most of the time. She never consulted any doctor for that.
Okay, you need to undergo audiometry test, is that okay?
I know about that test. I did take it a couple of years back. It measures how well you can hear different sounds, tones. I walked into a quiet room where the test was set up. The audiologist gave me a pair of headphones and explained that I would hear different sounds during the test. I was asked to press a button whenever I heard a sound, even if it was really faint. The sound started, some were high-pitched, others were lower tones. It was kind of like listening to music, but just short beeps. At times, the sounds were so soft that I had to focus really hard to catch them. The test also included some spoken words. I had to repeat them back to the audiologist to check how well I could understand speech. It wasn't stressful at all, and the whole process was quick and painless. By the end, the audiologist showed me the results and explained what they meant. It gave me a better understanding of my hearing and any steps I might need to take next.
That's exactly right. We need to do that again to check if there is any changes in your hearing capabilities.
Will you change my hearing aid after the test?
Definitely. Recent advancements in hearing aids have brought incredible features to improve hearing and overall user experience. Modern hearing aids use AI to analyze sounds and automatically adjust settings based on the environment. Some hearing aids now include neural processing units, NPUs, that mimic the brain's ability to focus on specific sounds, such as speech, while filtering out background noise.
That sounds cool.
End of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a patient and a doctor discussing test results. Now read the question.
Doctor, I've been waiting to hear about my test results. Could you tell me if everything is okay?
Yes, of course. I understand your concern. The good news is that most of the results look normal. However, your cholesterol levels are slightly elevated. It's nothing to be alarmed about, but we'll need to work on it to prevent any long-term issues. I recommend some dietary changes, reducing saturated fats and increasing your intake of fruits, vegetables, and whole grains. We can also explore adding regular physical activity to your routine.
Does this mean I'll need medication?
Not necessarily. For now, we'll try lifestyle adjustments first and reassess in 3 months. If there's no improvement, we can discuss medication options. Let's take it one step at a time.
Question 26. You hear a patient and a dietitian discussing dietary changes. Now read the question.
I've been diagnosed with prediabetes, and I'm not sure how to adjust my diet. Could you give me some guidance?
Certainly. The goal is to stabilize your blood sugar levels by making healthier food choices. Start by reducing refined carbohydrates like white bread, sugary snacks, and sweetened beverages. Instead, opt for whole grains, legumes, and fresh vegetables, which release energy more gradually. Portion control is also important. Try eating smaller meals more frequently to prevent blood sugar spikes.
What about fruits? I've heard they can have a lot of sugar.
That's a common concern, but most fruits contain natural sugars along with fiber, which helps regulate blood sugar levels. Focus on low glycemic index fruits like apples, berries, and oranges. Avoid fruit juices, though, as they lack the fiber and can cause a rapid increase in blood sugar.
Question 27. You hear a charge nurse briefing the team. Now read the question.
Good morning, everyone. I hope you're all doing well and managing the workload, especially during what has been a particularly busy season. I wanted to take a few minutes to highlight some key points about infection control, as this is an area where even minor lapses can have significant consequences for our patients and staff. Firstly, I cannot stress enough the importance of hand hygiene. We know this is second nature to all of you, but I'd like to remind everyone to be consistent. Hand hygiene must be performed before and after every patient interaction, whether it's as simple as adjusting a pillow or administering medication. The hand-washing stations and sanitizers have been restocked, and I encourage you to demonstrate this practice visibly in front of patients and their families. It's a small gesture that reassures them about our commitment to their safety. Secondly, personal protective equipment, or PPE, is another critical element. Always assess the situation and wear the appropriate gear. For example, when dealing with patients presenting with respiratory symptoms, masks and gloves are a must. Additionally, be mindful when disposing of PPE, ensuring it goes into the designated bins to avoid any contamination risks. Lastly, we've noticed that the communal high-touch areas, like bed rails and door handles, require extra attention. Housekeeping is doing their part, but let's be vigilant and use sanitizing wipes if you notice any areas that need immediate cleaning. I trust you all to uphold these standards, and please don't hesitate to bring concerns to my attention.
Question 28. You hear a speech therapist briefing staff. Now read the question.
Hello, team. I'd like to provide some tips on working with Mr. Khan, who is undergoing cognitive linguistic therapy following his traumatic brain injury. This therapy focuses on improving memory, attention, and communication skills. When interacting with Mr. Khan, use clear and concise language. Avoid giving him too many instructions at once, as this can be overwhelming. Instead, break tasks into smaller, manageable steps, providing visual or written cues when possible. During therapy sessions, encourage him to participate in activities that challenge his problem-solving skills, such as word games or simple puzzles. Repetition is key, so don't hesitate to revisit tasks he finds difficult. This will help reinforce his progress. Finally, remain patient and supportive. Recovery in these cases is gradual, and building confidence is just as important as the skills themselves. Let me know if there are any changes in his response to therapy or additional challenges he faces.
Question 29. You hear a nurse-patient discussion. Now read the question.
I've been feeling unusually tired and lightheaded lately. Could it be related to the new medication I started?
That's possible. Some medications can cause fatigue or dizziness as side effects, but it's important to monitor how severe these symptoms are. Have you noticed them occurring at specific times, such as after taking your medicine?
Yes, I seem to feel worse a few hours after the morning dose.
It could be a reaction to that timing. I'll note this and pass it along to your doctor. In the meantime, make sure to stay hydrated and avoid activities like driving if you're feeling lightheaded. If the symptoms worsen, let us know immediately.
Question 30. You hear a physiotherapy team leader briefing staff. Now read the question.
Good afternoon, team. Thank you for your continued dedication during what has been an exceptionally busy period for us. I know it's challenging to balance the increased workload, but I'd like to provide some guidance to ensure we're making the best use of our time and resources. Our first priority must always be patients who are in the immediate post-operative phase. These individuals are at a critical juncture in their recovery, and timely rehabilitation plays a significant role in preventing complications like stiffness, muscle atrophy, or even blood clots. For instance, Mrs. Gupta in room 3 had a knee replacement yesterday. She's starting mobility exercises today, and it's essential that we allocate sufficient time to assist her. On the other hand, patients with ongoing chronic conditions, such as Mr. Varma, who has been here for back pain management, can be scheduled later in the day. While their care is still important, their recovery timelines are more flexible, allowing us to address their needs without compromising those in acute stages. Communication is vital here. Make sure to inform these patients about their scheduled sessions to manage expectations and avoid confusion. Lastly, remember to document your sessions thoroughly. Highlight any concerns or progress in the patient notes so that the entire care team is informed and aligned. If you have any issues with prioritization or scheduling, feel free to reach out. I'm always here to help.
End of Part B. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a presentation by neurologist Dr. Brendan about Parkinson's disease. You now have 90 seconds to read questions 31 to 36.
Good afternoon, everyone. Thank you for joining me today. It is my privilege to share insights about Parkinson's disease, a condition that poses significant challenges to millions of people and their families worldwide. As a neurologist, I've seen firsthand the struggles of patients navigating life with this disorder, as well as their remarkable resilience. Despite decades of research on this condition, a specific test and clear treatment still remains elusive. I think the reason behind this failure lies in the nature of the disease, which is very complex. A factor believed to play a fundamental role in the development of PD involves abnormalities of a protein called alpha-synuclein. Few scientists say that there is some indifference in terms of funding towards Parkinson's research, however I beg to differ. Now let me start with the basics. Parkinson's disease is a progressive neurodegenerative disorder that primarily affects movement, but its impact extends far beyond motor symptoms. It is caused by the degeneration of dopamine-producing neurons in the substantia nigra, a small but critical area of the brain. Dopamine plays a central role in coordinating smooth and controlled muscle movements, and its deficiency results in the hallmark symptoms of the disease. Motor symptoms include tremors, which are often most noticeable at rest, rigidity or stiffness in the muscles, bradykinesia, which means slowness of movement, and postural instability that can lead to falls. However, non-motor symptoms, such as mood disorders, sleep disturbances, loss of sense of smell, and even cognitive decline, are equally significant and often overlooked. As with many conditions, early detection of Parkinson's disease is critical for effective management. However, diagnosing the disease can be tricky, especially in its initial stages when symptoms are mild and often attributed to normal aging. In my opinion, clinical observation and patient history remain indispensable tools for diagnosis. Some of my colleagues, however, argue for advanced imaging techniques such as D8 scan, which can detect dopamine transporter activity in the brain. While these scans are valuable, they are costly and not always available. Another debate in the medical community concerns biomarkers. Experts in this field are hopeful that biomarkers in blood, cerebrospinal fluid, or even tears may soon provide a reliable and non-invasive way to diagnose Parkinson's early. For now, diagnosis largely relies on the neurologist's expertise, which brings both challenges and opportunities. Now let me talk about a case study. I'd like to introduce you to Gail Brown, a 68-year-old retired farmer who came to our clinic a year ago. Gail began noticing balance issues and a slight tremor in her left hand. These symptoms initially seemed minor, but they gradually worsened, prompting her to seek medical advice. Her diagnosis of early-stage Parkinson's disease was a turning point. Gail enrolled in a physiotherapy program tailored to improve her balance and strength. Over just 12 weeks, she showed remarkable improvement, not only in her motor function but also in her confidence. This case illustrates that timely diagnosis and targeted therapies can empower patients to lead fuller lives despite their condition. Managing Parkinson's disease involves a combination of medical treatments, lifestyle modifications, and supportive care. Let us first discuss medications, which are the cornerstone of treatment. Levodopa, often combined with carbidopa, remains the gold standard for relieving motor symptoms. It replenishes dopamine levels and provides significant relief for most patients. However, long-term use of levodopa can lead to motor complications, such as dyskinesia, which are involuntary, erratic movements. Surgical options like deep brain stimulation, DBS, have also emerged as transformative for patients with advanced Parkinson's. DBS involves implanting electrodes in specific brain areas to regulate abnormal nerve signals. While the outcomes can be life-changing, it is not suitable for everyone and requires thorough evaluation. Another exciting development is the exploration of gene therapies and stem cell treatments. While these remain experimental, they hold the promise of addressing the root cause of the disease rather than just managing symptoms. It is my belief that the future of Parkinson's treatment lies in these innovative approaches. Despite the advancements we've made, Parkinson's disease remains incurable. The progressive nature of the condition poses a significant challenge, and our current treatments focus on managing symptoms rather than halting or reversing the disease. Ongoing research into neuroprotective therapies aims to slow disease progression. Some of my colleagues believe that interventions targeting alpha-synuclein, a protein involved in Parkinson's pathology, could be a game changer. Others express caution, emphasizing the complexity of the disease and the need for more robust data. Stem cell therapy is another area of interest. It has the potential to replace damaged neurons and restore normal dopamine levels. However, ethical concerns and technical challenges, such as ensuring the safety and longevity of implanted cells, need to be addressed.
End of extract 1. Extract 2. Questions 37 to 42. You hear an interview with Dr. Bella, dietitian, on fad diets. You now have 90 seconds to read the questions. Good evening, Dr. Bella. It's a pleasure to have you with us today to discuss a topic that seems to be everywhere, fad diets. Let's start by understanding what a fad diet is and why they attract so much attention.
Thank you for having me. Fad diets are essentially popular diets that promise quick weight loss or other dramatic health benefits. They're often characterized by restrictive eating plans, eliminating certain food groups, or relying on trendy ingredients or methods. While the allure is strong, they're marketed as easy fixes, they often come with significant downsides. What makes them so appealing is the promise of results with minimal effort. People are tempted by slogans like lose 10 pounds in 2 weeks or detox your body and feel rejuvenated. But what many don't realize is that these diets are not sustainable and can sometimes be harmful to overall health.
That's an interesting perspective. Can you elaborate on the risks associated with these diets?
Absolutely. Fad diets can have several negative consequences. Firstly, they often lack essential nutrients because they cut out entire food groups. Take the ketogenic diet, for example, it focuses heavily on fats and proteins while eliminating carbs. While it may work for some individuals, particularly those with specific medical conditions, for the average person, it can lead to deficiencies in fiber, vitamins, and minerals. Another example is the juice cleanse trend. People drink only fruit or vegetable juices for days, hoping to detox. This leads to a lack of protein and fats, which are crucial for cell repair and energy. Moreover, the concept of detoxing is flawed. The body has its own detox systems, like the liver and kidneys. Fad diets also tend to promote a quick fix mentality. They can cause rapid weight loss, but much of this is water weight rather than fat loss. When people inevitably return to their regular eating habits, they often gain back the weight, sometimes even more. The risks of fad diets clearly outweigh benefits.
Could you share any case studies?
Certainly. One of my patients, Ria, came to me after following the grapefruit diet for 3 weeks. This diet involves eating grapefruit with every meal and drastically cutting calorie intake. While she initially lost weight, she started experiencing fatigue, irritability, and even hair loss due to nutrient deficiencies. Her energy levels were severely impacted, and she was struggling to perform her daily tasks. Another case was a gentleman named Arjun, who tried intermittent fasting but took it to an extreme, consuming just 1 meal a day for weeks. While intermittent fasting can work when done properly, his approach led to dizziness, dehydration, and muscle loss. It was only after switching to a balanced meal plan and incorporating small, regular meals that he regained his energy and strength. In these cases, clearly it was not tailored to individual needs and failed to consider long-term health.
What advice do you offer to people seeking healthy weight management?
The key is sustainability. Weight management isn't about quick fixes, it's about long-term lifestyle changes. I always emphasize the importance of a balanced diet that includes all major food groups, proteins, carbohydrates, fats, vitamins, and minerals. Portion control, mindful eating, and regular physical activity are far more effective than following restrictive trends. For instance, I had a client named Priya who wanted to lose weight for her wedding. Instead of recommending a fad diet, I worked with her to create a balanced eating plan, emphasizing whole grains, lean proteins, fruits, vegetables, and healthy fats. She incorporated daily walks and yoga into her routine. Over 6 months, she not only achieved her weight goals but felt more energetic and confident. The best part? She maintained her health even after the wedding. I always tell my clients, the goal isn't just to lose weight but to gain health. A healthy relationship with food is far more valuable than a fleeting drop on the scale.
What is your though about intermittent fasting?
Intermittent fasting has emerged as an intriguing dietary approach that divides time between eating and fasting. Dietitians often discuss its merits and potential drawbacks, emphasizing its impact on both health and lifestyle. On the positive side, intermittent fasting can assist with weight management by naturally reducing calorie intake and enhancing insulin sensitivity. This method's flexibility appeals to many. It shifts the focus from what you eat to when you eat, offering a unique alternative to restrictive diets. Research indicates that intermittent fasting may also improve heart health, reduce inflammation, and even support better digestion, making it an attractive choice for health-conscious individuals. However, I urge caution, highlighting potential risks. Extended fasting periods could lead to nutritional deficiencies if essential vitamins and minerals are not adequately consumed. Women, in particular, might experience hormonal imbalances, including changes in their menstrual cycles.
Is there any impact on family because of diets?
As a dietitian, I understand the importance of healthy eating and fitness goals, but we must be mindful of the influence our actions have on the next generation. Children are incredibly perceptive. They watch, absorb, and often imitate the behaviors of their parents. When parents engage in dieting, especially if it's restrictive or centered around negative self-talk about food and body image, children can internalize these messages. They may begin to view food as an enemy or develop anxiety about their own bodies. Studies show that children of parents who focus heavily on dieting are at a higher risk of developing disordered eating patterns.
End of listening test. You now have 2 minutes to check your answers.